Advice for labor positioning. Labor: uterine contractions that result in effacement and dilation of the cervix. Stages of labor. There are 3 stages of labor. The first stage begins with the onset of contractions, ends with the cervix is fully dilated. Duration: primigravida 8 to 12 hours, multigravida 6 to 8 hours. Second stage. The second stage begins after the cervix has fully dilated. The baby's head has moved down into the birth canal. It ends when the baby is born. Duration: primigravida 1 to 2 hours, multigravida half an hour. Third stage. The third stage involves the expulsion of the placenta from the body. Duration up to 30 minutes. However, the length of the third stage of labor is 10 minutes. Stages of labor. Stage 1, Stage 2, and Stage 3. Role of physiotherapist. Role of physiotherapist during labor: relaxation, breathing techniques, positioning, pain relief, massage, other coping strategies, hypnosis, warm water bath, acupuncture. Swaying, rocking, or even dancing can help her body relax. Standing and walking can make labor go faster. Relaxation. Relaxation is an active, purposeful activity in which you consciously release tension. Relaxing your muscles helps to reduce physical tension and pain. It also provides a feeling of emotional well-being, which reduces anxiety and in turn reduces your sensitivity to pain. Benefits for mother. During pregnancy, relaxation helps her to cope with the physical, psychological, and emotional discomfort of pregnancy. During labor, it allows body to function efficiently with the minimum effort of energy is conserved and pain threshold is said to be increased. 2 reasons for teaching relaxation to use in labor: to prevent the mother becoming unduly tired, thereby causing nervous fatigue; to help the mother control her thoughts and feelings or emotions. Breathing technique during pregnancy. Breathing techniques. Benefits or purpose of breathing techniques: provides oxygen to mother, baby, and hard-working uterus. Well oxygenated muscles function more effectively and efficiently. Reduces pain. Relaxation. Rhythmic breathing promotes physical relaxation by reducing muscle tension and promotes emotional relaxation by reducing anxiety. Distraction. By helping the mother concentrate and focus on breathing instead of her contractions. During labor, there is considerable increase in oxygen requirement. More alveolar ventilation is necessary that will lead to hyperventilation. Due to hyperventilation, level of carbon dioxide falls. This causes respiratory alkalosis, leading to decrease in calcium ionization, which can affect nerve conductivity. Effect of hyperventilation. Signs and symptoms: dizziness, eventual unconsciousness. Cerebral causes: cerebral hypoxia due to constriction of cerebral vessels and reduced blood pressure. Numbness and tingling in the lips and extremities. Changed in ionized calcium caused by alkalosis, which affect nerve conduction. Breathing during labor. According to Williams and Booth, 1985, Stage 1, easy breathing, a little lower and deeper than usual. Transitional stage, breathing to prevent pushing. Fairly deep breathing to move the diaphragm up and down with a sharp blow out through relaxed lip. Second stage, 1 or 2 deep breaths in and out, then hold, making the diaphragm piston go down. Repeat when breath runs out after a gulp of air. Positioning. Because of the anteversion of uterus during first stage contraction, many women find that they instinctively need to lean forward on same sort of support. Some like to rotate or rock their pelvis. Leaning forward facilitates anteversion. Women should be encouraged to change position during first stage of labor. The knee chest position is sometimes helpful in assisting the elimination of the anterior lip of cervix. The supine position can reduce anteversion. The forward lean positions facilitate anteversion. Many women feel most comfortable leaning forwards. Anteversion of the uterus during first stages. Positions for laboring out of bed. Walking, standing, and leaning. All may help stimulate effective contractions. All use gravity to help babies descend. Kneeling may relieve back pain, helps baby rotate to most favorable position, occiput anterior, relieves hemorrhoids. Sitting uses gravity to help babies descend, allows rest between contractions. Squatting uses gravity to help babies descend, opens pelvis to provide more room. Standing leaning forward, slow dancing, the lunge standing, the lunge kneeling, sitting upright, sitting on commode, semi-sitting, sitting leaning forward with support, hands and knees, kneeling over chair rest, kneeling leaning on raised head of bed, kneeling over birth ball, side lying, squatting, supported squat, the dangle. Positions attended during first stages are sitting with head and shoulder resting on table, standing leaning against a wall either facing or with back support, stride sitting across a chair resting the head and arms on the back, on all four on floor supported by partner standing resting head on his shoulder. Walking, sitting leaning forward with support, kneeling leaning forward with support, hands and knees, standing, sitting upright, side lying, standing and leaning forward. Positioning during second stage of labor: lithotomy, dorsal recumbent, lateral and semi-recumbent. Lithotomy position, dorsal recumbent, lithotomy position. Lateral position, massage in labor. It is probable that soothing sensory inputs from stroking, effleurage and kneading activates the gate closing mechanism at spinal level. Area of massage: back, deep kneading over painful area, double-handed kneading over SI joint, effleurage from sacrococcygeal area up and over the iliac crest, slow rhythmical longitudinal stroking from occiput to coccyx can relieve tension, perineal massage. Site of possible back pain in first stage: deep reinforced kneading to the painful area, double-handed kneading may be required if the pain becomes severe. Effleurage and stroking for the relief of tension. The lower half of the abdomen is most common site of pain. Lateral stroking over the site of pain may give relief. Double-handed kneading, self-administered and synchronized with breathing, may relieve pain. Pain relief in labor: comfort measures: having a support person at your side helps keep you focused. Relaxation and breathing techniques help control anxiety and pain throughout labor and are best learned in childbirth education classes. Distractions such as music or TV in early labor. Imagery is picturing yourself in a peaceful place. Massage and use of cold packs ease muscle tension. Your labor nurse will suggest other methods of easing your early labor pain. When contractions are closer together and stronger, rest in between, take slow, deep breaths. Touch and massage, including the use of creams and oils, heat and cold, and counter pressure. Being active during labor rather than staying in bed position, changes like walking, squatting, sitting, the hands and knees position, and using a birthing ball can all be helpful. Pleasing surroundings with the use of music, dim lights, and aromatherapy. Use of warm water, bath, or shower may help reduce labor pain. Sterile water injections involves injecting small amounts of sterile water into the skin in the lower part of the back. This helps women in early labor who have back pain. Hypnosis and acupuncture may be helpful in some women during labor. Use of TENS in labor. Benefits of using TENS in labor. TENS is a form of non-invasive pain relief. TENS has no harmful effects on either the mother or baby. TENS does not restrict your ability to move about in labor. TENS can be applied at home during early labor. Other pain relief options can still be used if TENS does not provide you with adequate pain relief. Modes of stimulation. Two of the TENS parameters are used for labor. These are burst train TENS and brief intense TENS. Burst train TENS, this is characterized by low frequency bursts, 4 Hz, of high frequency stimulation. This type of stimulation has the properties of both conventional TENS and acupuncture TENS like TENS. Conventional TENS has its effect by stimulation of the A and alpha fibers to inhibit the C fiber mediated pain sensations presynaptically at spinal segment. Conventional TENS may take 5 to 10 minutes before pain relief is experienced. Acupuncture like TENS will produce analgesia that is long lasting but may take about 30 minutes of stimulation before effects are noted. Brief TENS, this is characterized by a higher frequency 100 Hz, a long pulse duration 150 seconds, and the highest intensity that can be tolerated by the patient. This is best used for short periods of time, 5 to 10 minutes, owing to the fatigue generated in the nerves from this TENS type of stimulation. The effect can be almost instantaneous owing to the localized blocking of nerve conduction. These two modes of stimulation are used for the specific instance of labor because they suit the specific nature of labor. Visceral pain is conducted to the spinal segment via C fibers, and this type of pain is best tolerated by the use of endorphin mechanisms and closing the pain gate. This is why burst TENS is used all the time during labor. Placement of electrodes. Electrode placed over relevant vertebral segments that receive nociceptive information from painful areas or the areas which giving pain. During the first stage, labor pain information when pain is at its most intense will be entering segments T10 to L1. The information from the presynaptic, parasympathetic nerves and the pudendal nerve arrives at the spinal segment S2 to S4. Each pair of electrodes will be placed on either side of the spinal column, one pair covering either side of the spinous process of T10 L1 and the other pair covering either side of the spinal process of S2 to S4. How is TENS used? In order to manage your pain more effectively, it is important to use TENS as early in labor as possible. TENS is more effective if we use it in combination with other coping strategies such as relaxation, positioning, and massage. The TENS electrodes need to be positioned over the nerve pathways which transmit pain messages from the uterus and cervix during labor. Electrodes should be positioned on mother back paravertebrally over dermatomes T10 to L1. For second stage, additional electrodes over S2 to S4. Initially, you may wish to start with the channel 2 electrodes placed either side of the spine just above the waist. As your labor progresses, or if you are experiencing lower back or pelvic pain, you can start using the channel 1 electrodes which are placed either side of the lower spine below the waist. The channel 1 and channel 2 electrodes can be used at the same time if needed. Safety limits. Fetus most at risk if the electrodes placed abdominally. The woman very thin, having only 1 inch of abdominal fat. Postnatal care aims: strengthening of pelvic floor muscles, strengthening of abdominal muscles, diastasis recti, back care in all positions, baby care. Advice for posture with baby: strengthening of upper limb, care of perineum. Start of exercise should start within 6 weeks of delivery. Time differ according to the health status of the mother. Pelvic floor muscle: start within 24 hours after delivery if possible. Perineum numb, so felt at anus only. 4 to 5 times at frequency interval throughout the day. Apprehension due to stitches or pain, but it will increase circulation, promote healing, and relieve inflammatory exudates. Pain relief. Increase contractions up to 50 per day, linked to the daily activities: washing hands, feeding baby. Care of perineum: keep the area dry. During bowel movement, support by clean sanitary towel. Relief of perineal pain: sitting on a ring cushion between folded pillows, less pressure on perineum. Side lying, lying or side sitting for breastfeeding. Prone lying, pillow under abdomen and a lower leg for relieving pressure on breast. Relief of perineal pain: ice application for pain relief. PEME, low intensity for 5 to 10 minutes to promote healing. Ultrasound underwater for softening of scar tissue. Strengthening of abdominal muscles, back care: rolling on one side for getting out of bed, avoiding straight sit-up, etc. Diastasis recti, examination and treatment: curl up and down, prone, alternate leg raise and gluteal contraction. Strengthening of abdominal muscles, quadruped, all 4 leg raise, sitting, sideward, trunk bending. Postural correction: proper feeding posture, postural correction exercise. Baby care: lifting posture of the baby, feeding posture of the baby. Lifting posture of the baby, feeding, breastfeeding. Cross cradle, inverted side lying, side lying cradle, cradle. Strengthening of upper limb, stretching of neck muscles, arm raising exercise, heel stretch. Electrotherapy IFT: first identify the target tissue: urethra, external urethral sphincter, smooth muscle walls. Low frequency range 0.5 to 15 Hz. Pelvic floor muscles, medium frequency range 40 Hz to 80 Hz. Electrotherapy: electrode, 4-pole, placed on the buttocks, medial to ischial tuberosities and lateral to the symphysis pubis on obturator foramina. 2-pole either side of the perineum. Intensity maximum that is comfortable. Duration 15 to 20 minutes. Electrotherapy: ultrasound, combination of pulsed ultrasound and massage. Best frequency 1 MHz, intensity 0.5 to 0.8 watt per centimeter square. Pulsed, duration 5 to 10 minutes.